Hello and welcome to Module 4 of the Shapes of Grief training program. My name is Liz Gleeson and I'm here just to give you an overview of what to expect in this module. This is one of my favorite modules in the program and it is packed with some really great information and learning for you. An area of real interest to me is grief in the body, how grief manifests in our body, the physiology of grief, if you like, what is going on internally. And as a clinician, this has been immensely beneficial to me to understand what's happening in our bodies, what's happening particularly in our nervous system, and how I as a clinician can use my body and my nervous system to meet the people that I support in a really positive way. So there's a lecture on how grief manifests in the body. We meet with Jill Mann, again, psychotherapist, author, and bereaved mother, who looks at choice in grief. At what point or at any point do we have a choice in how we grieve? So this is a really interesting presentation and there's lots of food for thought in Jill's words about choice and grief. Her psychotherapist Juliet Rosenfeld and Dr. Dan Gordon, a GP, talk about death denial and death anxiety. We look at why we have these defenses, why we choose denial over truth, and the importance of denial, and then the role of the clinician supporting the patient who is in denial about their diagnosis. Dr. Esther Ramsey-Jones, psychotherapist in the UK and author, takes us through a lovely lecture on intimate dying, how to care for people when they are dying, how do we make it a tender, positive, and compassionate experience. I offer a lecture in counselling in bereavement and loss. So how does supporting people who are bereaved differ from regular psychotherapy? And there are differences, and we do need to show up very much with our humanity when it comes to grief and loss. So there's a long lecture here looking at the many facets of grief counselling and grief therapy, how they differ to each other, and also how they differ to regular counselling and regular psychotherapy. For anyone working in this field, it's so important that we understand self-care and burnout. So how do we stay well to do this work? Because it's absolutely essential that we stay well when we are working with grief and loss. We are meeting other people's traumas every day in profound grief. It's so vital that we understand our own traumas, our own grief, and that we are caring for ourselves before we can even think about supporting someone else. Dr. Sheila Boland, clinical psychologist and also a bereaved mother, talks about the needs of the families when their child is terminally ill. So Sheila's been through this firsthand, both as a professional and then also personally when her young son Oisin died some years ago. Sheila looks at what the research tells us about supporting families who are anticipating loss and who have experienced loss as well. Another essential lecture in this module is ethical practice in grief counselling. There is so much unethical practice out there. We have people supporting people with significant bereavement, significant trauma without any training. And really, it's not okay in this day and age. The standards in the UK tell us that anybody working with people who are experiencing significant bereavement should have done at least 30 hours of grief training or grief education before embarking in this type of work. And the recommended CPD hours or continuous professional development per annum is 12. Now, many of us fall short on this, which is why I've developed the Shapes of Grief training program in the first place. But it's so important that we understand our own limitations. We all want the people we support to have the very best possible outcomes. And in order to ensure this, we need to understand our own limitations, work in an ethical manner, and know when it's important to refer on, to know when something is outside of our scope of competence. So really encourage you to watch this lecture, Ethical Practice in Grief Counselling. Who looks for grief therapy? We know that from the research, 60% of people who are significantly bereaved do not need professional support. And this is really important for us to know. We can often be so quick to say, oh, they need counselling or they need therapy. Grief is a normal adaptive response to loss. And with the right supports from family, community, and friends, most people, the majority of people, 60%, do not need support. So who are the other 40? So in this lecture, we're going to look at who does look for grief counselling and why that happens. So this is really important that we understand the risk factors following a bereavement. We know from the research, broadly speaking, who might need extra support. So as clinicians, that we keep an eye on this, and also that we're not sitting there supporting people having a normal adaptive response to grief and loss because they think something's wrong with them. Our job is also to normalize the grieving process and let people know that, you know, what they're experiencing is normal and natural, and they may not need counselling at this point. And that's also very important. Our last presentation in Module 4 is from Dr. Diana Sands in Australia. Dr. Sands is an expert in bereavement after suicide. And in this lecture, she offers us an intervention, creating a resilience cloak. So it's a lovely intervention. And Dr. Sands takes us through this intervention step by step. So that's it for Module 4. Lots of learning. Take your time. And as always, try and join us in the online group where you can develop your learning further. Enjoy the module.